everyone, this is my balance scorecard discussion. So I will start with just the strengths and weaknesses from my clinic at Bethany Physical Therapy. So basically, the strengths are that it can give us a broader and well-rounded view of our performances. It helps the company measure how we're doing with our staff, with our patients, and just our internal processes. So it's a lot bigger than just focusing on profits. It's kind of all around how the company's doing. I think it will help just improve communication and accountability. Everyone can see what we're working towards, how we're supporting the company's mission of providing that compassionate care and effective care, essentially. And then it's also giving the leaders, who can be directors, upper management, data-based decisions. So we have all the data to back up our goals and how we're going to hit those goals. An example of this just could be, if the patient satisfactions drop, then our balance scorecard can identify which objective is causing the issue. That could be our staff training, it could be our internal stuff, it could be some type of scheduling administrative stuff that is affecting patient satisfaction. So it can be easy to go back and try to track what's going on. The weaknesses is that, as we've all learned, it's very time consuming. There's a lot of data, and when you are running multiple busy clinics, data changes a lot, and so it would be hard to keep that very consistent and up to date. So it could just be very difficult to keep it accurate. And then I think how I would use these elements to manage my team, I would focus on mostly the customer and patient satisfaction. I think focusing on that aspect would help to show that we are putting patients first, and that's giving them quality care. That's learning how to communicate with them effectively, and just driving up those patient satisfaction scores. So that would be one of them that I'd focus on. The other one I would focus on would be learning and professional development, getting our staff trained up, cross-trained, making them more valuable to our company, continuing education. I know that we have a lot of programs for our physical therapists to continue their education and do cohorts to keep them up-trained. And and then also just being able to engage with the staff more, whether we have conferences or regional meetings. I think that helps. That would help my team just stay more focused on our company goals and our clinic goals, and it would give them the tools and information to support our organizational goals, essentially. Overall, I just think that the balance scorecard can make our goals just clear and measurable for everybody. So it doesn't matter what department you're in. You could be the administrative, the clinicians, our aides that help out, all kinds of different departments. I think it can help us give a clear idea of where our company is headed and the needs that need to be met, and that gives us an idea of how we can contribute individually to our company mission. So anyways, I hope you guys have a good rest of your week, and I will see you week 3.